So yellow fever is a disease that is transmitted by a virus. It's carried by a mosquito called Aedes, from the Aedes family, and it's called Aedes aegypti. The very first few days is hard to recognize because it's a disease that has symptoms that are common to many viral disease, fever, headache, muscle ache, etc. But then after the first phase, you enter in the real yellow fever phase because the patient has fever but is also jaundice. Sometime at the end of the disease you can have hemorrhage, and this is why it's very important for yellow fever patient to go as soon as they have symptoms and they suspect it's yellow fever to go and to seek treatment. There is no specific treatment, but a good clinical management can help also to for people to recover from this disease and not die from it. The first few cases were detected in December. But then around the end of January there was many cases, and the problem was that there were cases in the capital city. And it's always very difficult to deal with an outbreak in a capital city because of the density of population, but also the density of mosquito, because this outbreak of yellow fever, yellow fever in general, is transmitted by mosquitoes. There is a very good vaccine for yellow fever. And this vaccine is safe because really the number of adverse effects following vaccination is really negligible. And the good news is also that this vaccine protects for a very long period of time, probably entire life. And this is why it's a mainstay of the response for yellow fever outbreak is really vaccinating people. WHO has a global emergency stockpile for yellow fever that is used to help countries to face outbreaks of yellow fever. This emergency yellow fever vaccine stockpile is composed of 6 million doses. But the problem was with Angola outbreak is that the outbreak was in a big city with more than 6 million people. So we had to use immediately the entire stockpile. And now the stockpile has been replenished and we are sending more vaccine to finish the vaccination in the capital city. Yes and no. Yes, because as any outbreak, there is always a risk of amplification, and also the outbreak can go to other countries and then produce problems in other regions. And no, because fortunately for yellow fever, we do have a vaccine. The vaccine is safe, vaccine is effective, and we can control the outbreak. I think what is very important is that people traveling to yellow fever endemic countries needs to get vaccinated. It's one of the recommendations of the International Health Regulation, but unfortunately many people are not vaccinated still. So I think everybody has to get vaccinating against yellow fever if they are traveling to yellow fever endemic countries. And WHO has a list of those countries that are endemic, and people should look at our website to know before they travel what is the risk. And then this disease is transmitted by mosquitoes, so as in the same mosquito as dengue, Zika, chikungunya. And so I think people also, when they are traveling to countries where this mosquito is present, should also protect themselves against mosquito bites.